Hello, my name is Danelle Schmidt, and today I would like to talk to you about type 1 diabetes. Type 1 diabetes affects millions of Americans every year. That is why I felt this presentation was necessary. Each and every one of us most likely knows and/or loves someone who is affected by this pathological disease through no fault of their own. But do you actually know what this disease is, what it does, how it affects the individual that lives with it? Do you know how this disease affects the rest of their lives? Making others aware of these facts regarding this disease is very important from an education. The American Diabetes Association cites diabetes as the seventh leading cause of death in the United States in 2010, and the number of diagnosed cases is steadily increasing each year. According to the association, in 2012, 29.1 million Americans, or 9.3% of the population, had diabetes, which was an increase from the 2010 totals when there were 25.8 million, or 8.3% of the population affected. Individuals need to be aware of the signs and symptoms of the diagnosis, treatments, and preventative steps, as well as the short-term and long-term consequences of this deadly disease. What is diabetes? Since the exact cause of type 1 diabetes is currently unknown, there are no preventative methods or cures available at this time. All that is known is that it is a defect in the immune system. Early detection and treatment are crucial. Scientists have been able to isolate a few factors that may be related to the development of this disease, which include type 1 diabetes is more common in individuals under the age of 30 and usually tends to begin in childhood. It is determined by various factors such as genetic predisposition, other autoimmune disorders, childhood obesity, risks increase with increased birth weight, increased age of mother during pregnancy also factors into it, ethnic population, as well as environmental factors all play a part in if one person ends up with the type 1 diabetes illness or not. So what causes diabetes, you may wonder? It results from autoimmune destruction of the beta cells of the islets of Langerhans in the pancreas, which produces insulin. The destruction compromises the individual's ability to respond to changing levels of glucose in the blood because insulin cannot be produced. To use glucose for energy, insulin needs to be secreted by the pancreas. Insulin removes excessive glucose from the body, which otherwise could be toxic in high levels. Insulin plays an important role in the metabolism of carbohydrates, fatty acids, and amino acids in the body. A type 1 diabetic person's body destroys those beta cells, causing their body to become insulin deficient or deprived. Type 1 diabetic individuals need to supplement their body's lack of insulin with administration of artificial insulin, which is insulin not being produced by their own bodies. So why is insulin important? Insulin's main functions when it comes to glucose regulation in the body, which is dependent on the glucose levels and the cell's needs, are insulin allows glucose to enter the cells. It helps glucose turn into glycogen in order to store energy in the cells. Insulin also inhibits the breakdown of glycogen and glucose when the body needs glycogen stored and lesser amounts of glucose from the liver. The digestive system breaks down carbohydrates into glucose, which is blood sugar. This glucose is then transported to each cell through the bloodstream. The pancreas secretes insulin, which is a hormone that allows that glucose to migrate from the blood into the cells. Once the glucose is inside a cell, it is burned, along with oxygen, to produce energy. A person with type 1 diabetes does not make enough insulin to keep blood glucose normal. However, high levels of glucose remaining in the bloodstream without insulin causes the body to try to correct the problem with other sources of fuel, such as stored fats. Ketones, which are dangerous in high levels, are created by extensive fat burning. Some of the signs and symptoms to look for type 1 diabetes include extreme thirst, polydipsia, increased frequent urination, polyuria, unexplained weight loss, extreme fatigue, nausea, blurred vision, as well as extreme hunger, polyphagia, weakness, irritability, cuts and/or bruises that heal slowly, headaches. The onset of these symptoms may be sudden. If an individual experiences any combination of these signs or symptoms, they should talk with their healthcare provider and see if they should be tested for type 1 diabetes. Diagnosing type 1 diabetes can include a number of different testing options. These possible tests can include AIC testing that measures the average blood glucose level over a 2 or 3 month time period. Fasting plasma glucose FPG testing that checks fasting blood glucose levels as well. Oral glucose tolerance test, OGTT, which is a 2-hour test checking blood glucose levels before and 2 hours after drinking a special drink, can also be a way to test for type 1 diabetes. Random and casual plasma glucose test is also an option that involves testing whenever severe diabetes symptoms are present. And these are all testing options available to individuals who are suspected of having type 1 diabetes, and their doctor may suggest these tests. Complications of type 1 diabetes may include skin complications such as bacterial or fungal infections, itching, as well as certain diabetic skin conditions. Type 1 diabetics may also experience complications in their eyes. Some of the eye issues associated with type 1 diabetes include, but are not limited to, glaucoma, cataracts, and retinopathy. Individuals with this disease are at a higher risk for blindness than individuals who do not have type 1. Neuropathy or nerve damage is another complication of type 1 diabetes. Diabetic neuropathy affects about 1/2 of all diabetic individuals and is more common in individuals who have had the disease for longer periods of time. Keeping blood glucose levels on target may prevent or delay nerve damage, according to the American Diabetes Association. Complications in the feet are also associated with diabetes. Individuals may suffer from tingling, pain, burning or stinging, and/or weakness in their feet, neuropathy in the feet, skin changes, calluses, foot ulcers, poor circulation, and the ultimate possibility of foot or leg amputation are all complications. Individuals with type 1 diabetes can also suffer from a number of other complications such as DKA, ketoacidosis, and ketones, which is a serious condition that can lead to diabetic coma or even death, as stated by the American Diabetes Association. Kidney disease is another complication associated with type 1 diabetes. The list of possible complications resulting from type 1 diabetes is a long list, which can include high blood pressure, stroke, hypersmolar hyperglycemic non-ketotic syndrome (HHNS), gastroparesis, heart disease, as well as increased potential for infections. Poor blood circulation, sexual impotence, mental health issues such as anger, denial, and depression, and becoming pregnant can all cause issues and affect type 1 diabetic individuals. Treating type 1 diabetes. Treatment of this pathological disease include close monitoring of blood glucose levels, modifications to diet and exercise, taking daily injections of insulin or obtaining insulin via a pump, self-monitoring of blood sugar levels using a glucose meter, self-testing urine, as well as a number of other medications can be prescribed by your physician. Individuals should perform regular checkups with their healthcare provider in order to verify that the treatment is working successfully. If left untreated for a long period of time, the high blood glucose levels created within the body can damage vital organs, blood vessels, the heart, kidneys, eyes, as well as nerves. Since the exact cause of type 1 diabetes is still unknown, there are no preventative measures or methods available at this time. Therefore, management of this disease is crucial, along with education. I hope you enjoyed this. Thank you.